Okay. Welcome everyone to the HEIW All Wales Foundation Pharmacist Programme Virtual Fair. It's a lovely mouthful, but thank you for all joining today, and I hope you find it useful and informative for deciding what you're going to do with your foundation training year. My name is Martin Jane. I am one of the regional leads at the HEIW Foundation Pharmacist Programme, and I'm going to be hosting you guys today and guiding you around all the different presentations we're going to be doing, and offering you the opportunity to ask questions and find out any kind of information you want to. Okay. So just before we start, just some housekeeping. Just remember that keep yourself on mute just to try and minimize any noise disruption during the event. If you have any questions, however, please pop them into the chat box. We've got some of my colleagues will be monitoring the chat for any kind of questions, so they can interrupt me or any speakers presenting, so we can ask those questions. Or if you want to, you can raise your hand and ask directly, whichever you want. Questions are really welcome, and we'd like this to be as interactive as possible, though I know it's not always, really easy when it's a virtual event, but we'll try and do it as much as we can. Okay. So what are we going to be doing today? So this is the agenda for our event. We're first going to introduce you to HEIW and why we think you should train in Wales. As part of our programme, we take great pride in the fact that it involves input from partners across pharmacy in Wales. And so we will then hear presentations from our partners across the 3 sectors of pharmacy delivering our programme in Wales. That will be from primary care, community pharmacy and secondary care. We also have a pharmacist with us that went through our program last year as a trainee, and she's going to be sharing her insights of her experiences on the program. And then the second part of our session today, our event, will be the opening of some breakout rooms based on geographical locations around Wales, with 2 health boards based in each. So you as students and prospective trainees next year can choose which breakout room you wish to visit and listen to the health boards within, explain why they think you should apply to their localities and the kind of great experience they're going to give you while you're on the program with them. We'll have 2 rounds of these breakout rooms of about 25 minutes. So you'll have a chance to listen to 4 health boards. And then what we'll do then is rejoin at the end just to close the event. Okay. So just to start with, who is HEIW? Who are we? Why are we running this event today? So we are the statutory education body in Wales, and we're kind of like the equivalent to Health Education England in England, or NHS Education Scotland in Scotland. We're a relatively new organisation. We established in 2018, and we're a special health authority that sits alongside the other health boards and trusts in NHS Wales. Big part of what we do is ensuring we have the right staff, right skills to deliver world-class healthcare to the people of Wales, both now and in the future. And as part of that, we are responsible for delivery of foundation pharmacist training in Wales, along with all of our wonderful partners across the spectrum in NHS Wales. So our responsibilities as far as the programme delivery goes is we're responsible for recruitment and marketing, which is why we're running this session today. We help develop we have developed a curriculum in partnership with many stakeholders, which is all mapped to the GPHC learning outcomes to make sure that the curriculum is fit for purpose and that you get all the learning objectives and outcomes that you need from our programme. We look after rotation and placement management, so assigning people to the different rotations, what rotation you go first, second, or third, but we'll go a bit more detail on that later. Obviously, we quality manage the programme. We are also responsible for delivering the Offsite Programme. We support any trainees that require additional assistance for whatever reason that is. That can be for health reasons or just learning needs. Anything that they need support with, we will be there. And of course, any kind of fitness to practice issues. Okay, why train in Wales then? So why come to us to train? Maybe because of the outdoors. It's right on your doorstep. You're going to have mountains, coastlines, rivers, everything you want. Maybe because of the history, we have a wide range of historical attractions to visit. Maybe for the social life and the people, we're all very friendly in Wales. Those are all great reasons, but we also take foundation training incredibly seriously in Wales. And as such, we are able to deliver an excellent programme to our trainees. On the whole, though, I think there are 4 key reasons for choosing to train in Wales as a foundation pharmacist, as a trainee pharmacist. And we're going to look at those now one by one. So first of all, we are going to be delivering the first fully multi-sector programme in the UK. All our placements in 2022-2023 will be rotational multi-sector placements across all 3 sectors of pharmacy. So there'll be 4 months, you'll spend 4 months in primary care, 4 months in community pharmacy, and 4 months in secondary care. We have 111 placements across Wales, open for you guys to apply to. And all of our placements are quality managed with support from the HEIW team. Why have we developed this program then? Why is it all multi-sector? Because, you know, a lot of the other countries, England and Scotland, still run some single sector, some multi-sector. Well, the reason we've done this is to build a flexible pharmacy workforce with the skills and competence to deliver the vision of a healthier Wales, which is the policy of the Welsh Government for delivering health and social care in Wales. Because a workforce that can work, communicate and understand the whole patient care pathway is essential to the efficient management and delivery of patient services. We want to provide opportunities to experience and deliver pharmaceutical care in a range of settings and allowing you to experience the patient journey in and across all sectors and understand how these sectors interlink and prevent the breakdown in communication that occurs when patients transfer from one sector to the next. So we aim to take the trainee pharmacist from a student level, where you are now in year 4, to a professional pharmacist by the end of the programme. And the curriculum we've got is purpose-built, mapped to the GPHC interim learning outcomes, and was created with input from stakeholders across Wales in hospital, community pharmacy, primary care pharmacy, and higher education institutions as well. By the end of the year, this is what we want our day 1 pharmacist to look like. We want you to be a patient-centered pharmacist at day 1. We want you to have complete understanding and experience of the patient journey and how the different sectors of pharmacy interlink. Be competent and confident in any area of practice as a well-rounded day 1 pharmacist. And we want you to have received support from trained supervisors in each sector. So on to our second main reason I think you'd want to apply to Wales. So in Wales, we have a single lead employer for all of our foundation pharmacist trainees. This was launched initially for GP trainees back in 2015 in Wales, and these arrangements resulted in a number of benefits to trainees. Essentially, you're all going to be on a level playing field and allowed easier transitions between rotations during the training programme. You'll be employed by the NHS through an organisation called NHS Wales Shared Services Partnership, NWSSP, for 12 months. You'll be employed on a band 5 terms and conditions, which is approximately £25,000 per annum wage. You'll have protected half-day study time per week. You'll have 27 days annual leave per year, and you'll have access to employee assistance programme through NWSSP and all the other benefits that come with NHS employment. Thirdly, we have consistently high pass rates, above average pass rates for our trainee pharmacists. And for the past 2 sittings, trainees from Wales have had the highest GPHC assessment pass rate in the UK. So you can see here in green was the ones for 2019-2020, and Wales was highest on 91.5, Scotland 90.6, England 87.9. And then for the last results for 2020 to 2021, England trainees 80% passed, in Scotland 86.7, and in Wales 88.3. So if you come to Wales, you're likely to have the highest chance of passing the registration assessment. And this is just an excerpt from a news story run on our website when we were able to achieve that second top rating for this year. So we also finally offer an excellent offsite program which will complement the training you receive on site in your placements. Bethan, our ops lead, and her team pride themselves on preparing a fantastic offsite program for our trainees. And the other regional leads and I love delivering the content every month. And we get to see you then face to face every month as well, and build up that rapport with you, get to know you as people, and support you through your training year. Through the offsite program, we currently run 13 days where you come out of your site and come to attend a training day. We normally do once a month, but there are some months where we have 2 training days in the same month. Since COVID, we've gone to a blended approach. So the most of our study days are on face-to-face, but we do keep a couple of the monthly training days as virtual training, just to help keep that flexible approach. And some of the training we ran still lended itself quite well to virtual training. And it also gets you to keep getting that experience of maybe working from home, which more and more of our population workforce are starting to do. We run a full mock exam once a year for part 1 and part 2 GPHC assessment papers. We also run practice papers every month as well. We run practice OSCEs. We have access to a prescribing safety assessment, which help develop your clinical skills and your consultation skills. And all our sessions tend to be facilitated by expert speakers. So when we train you on cardiology or respiratory or medicines information, I'm not doing that because I'm not a cardiology or MI or respiratory pharmacist. We get the experts in those fields to come and talk to you about those topics and lead on those sessions. We've also run new sessions this year on physical examinations, prepping for the time when you'll be IPs, so you'll be appreciative of the skills you'll need for that time. We also had mental health, teamwork, assertiveness, and vaccination training this year as well, and that will be rolling across to next year. You also have access to a host of online resources through our website, Moodle, and we'll facilitate your accreditation via the National Enhanced Services Accreditation, which will allow you to provide services in community pharmacy if you end up in community pharmacy after your training year. And all of our study days are facilitated by myself and my other colleague regional leads. And like I said, that gives us that chance to build that rapport and relationship with you guys so we can support you and help you through your year. So here's an example of some of the offsite training program that we run this year. So some of the topics we covered in the different days. So stuff like, so when on your first day out, we go through the introduction to the course, e-portfolio, professionalism, whatnot. And then we start to delve into some more of the clinical topics, antimicrobials, respiratory, cardiovascular, medicines, information, pain. So it really is a really excellent training provision and offer for you guys for your offsite training. Remember, coming to Wales to carry out your foundation training doesn't have to end there. We at HEIW are currently exploring the offering that will be made for post-registration foundation pharmacist training. As you know, there's a whole host of changes going on in the initial education and training of pharmacists at the moment. We will be incorporating those changes into our program over the coming 4 or 5 years. And we are also looking at what we're going to be doing after that. So once you qualify as a pharmacist, what support you need for that. So we recently run an event in September looking at post-registration foundation pharmacist training in Wales. And there's a document summarising a recent stakeholder event due to be released on the 12th of October. So should have been yesterday. We got snapshots here, and in there's a link to the recording of the live event held then in September and a summary of key themes and findings. But if you have any questions, there's contact details in that report to raise to heiw.ietp@wales.nhs.uk so you can find out some more information about the offering there. Also, with the name of our program being to develop day one pharmacists that can practice in any sector of pharmacy, your job opportunities will be wide following completion of your training year. You'll be ready to practice in any sector of pharmacy in Wales and across the UK. Wales will not only be a great place to undertake your foundation training, but also a great place to develop your early career, as commitment to pharmacy in Wales is fantastic, and it's seen as a key part to delivering the goals of a whole system approach to healthcare. This quote, which I'll just give you a second to read, shows the level of commitment that Welsh Government has shown to pharmacy and our training programme in Wales. So this is from Andrew Evans, Chief Pharmaceutical Officer for Wales. So pharmacists who choose to come to Wales can benefit from a well-integrated healthcare system, facilitating knowledge sharing and innovation across a wide range of settings, allowing us to give our patients the best care possible. And that's what we want. We want to have a fantastic healthcare system that gives the best care possible to our patients. Thank you very much. I hope this has shown how exciting it is to train and practice as a pharmacist in Wales, but now we're going to hear some more from some other colleagues running the training on our programme. Does anyone at this point have any questions over anything I've covered here before we move on to our next presenter? No? Caris, are you ready? So our next speaker is Caris Spencer. She is one of our community pharmacy partners, and she is currently a designated supervisor in an Aidan Bevan University Health Board, and she's going to be speaking to you about community pharmacy and what experiences you'll have as trainee pharmacists in community pharmacy on our programme.
Thank you. Can everyone see my screen?
Yes.
Well, hi everyone. Yeah, my name is Caris. I'm a community pharmacist in Pontycymru Pharmacy, which is an independent pharmacy in Cwm Taf. The community pharmacy sector is really exciting to be in at the moment because, as Martin touched on, we've got this key document from Welsh Government, Delivering a Healthier Wales, which sets out their long-term plan for health and social care, with the aim for community pharmacy to achieve a number of goals and become an essential part of the multidisciplinary team within the primary care cluster. So these goals include training an independent prescriber for every pharmacy by 2030. These pharmacists will be able to specialise in prescribing for a number of conditions, for example, UTIs, ear, nose and throat complaints, as well as expanding the current common ailment scheme. Community pharmacy is also going to play a key role in managing long-term conditions and become health and wellbeing hubs, working collaboratively within that primary care cluster to focus on prevention of illness and disease. So these aims will support our GP, emergency care, secondary care colleagues to distribute resources more appropriately and deliver top quality patient-centred care to the people of Wales. So relating that to the current role of a community pharmacist, the highlights of my role at the moment are certainly the face-to-face conversations you have with people. You really do become a member of the community and you get to know patients and you get to have a real impact in their care. So we work collaboratively with a variety of healthcare professionals. On the regular, I speak to dentists, opticians, GPs, nurses, and our hospital colleagues to deliver this patient-centred care. Within the pharmacy itself, I deliver services such as the sore throat test and treat, which is a new service that can give antibiotics for people with throat infections. I help people quit smoking. I deliver flu vaccines. I help people with common ailments, and I'm able to supply certain medicines free of charge. And I do discharge medicines reviews, so I help to prevent errors after people come out of hospital with the medication prescribing. And relating that to a trainee pharmacist, as Martin said, you're very much training to be a competent pharmacist from day one. And certainly all the trainees I've experienced have been working at a second pharmacist level very, very quickly. So you have very good hands-on experience with patient care. You'll be dealing with queries and patient consultations very independently, and you'll be delivering services alongside the pharmacist. My trainee and I, we work together to deliver most emergency contraception services. We've done a couple of flu vaccinations together where the patient consents, and my trainees are fully involved in the prescription journey. So they're very capable of labelling, clinically checking, and accuracy checking prescriptions under supervision. it's really a very exciting time to be in community pharmacy. And if you're a very sociable person, or if you like being involved in delivering patient-centred care, then it's very, very good to be in at the moment. And if anybody has any questions for me directly, then feel free to get in touch with Hugh, who will pass them on.
Wonderful. Thank you so much, Caris. That was a great presentation. Does anyone have any questions for Caris now before we move on? Happy to just take them as we come. Otherwise, it is really exciting in pharmacy in Wales, and community pharmacy especially is very much undergoing a lot of change at the moment. There's lots of new avenues opening up for pharmacists and community. It makes me miss my full-time practice. Okay, wonderful. Shall we move on to our next presenter? I don't see any questions coming in at this point. So Bethan Owen, you ready?
I am. Let's
see. There she is. So next we have Bethan, who is one of our training program directors for our program up in North Wales, and she has a background in primary care, and she's going to be sharing her insights around primary care pharmacy now. Thank you, Beth.
There we are. Can you all see the screen? Yes, great. And you can hear me. So I'm Bethan Owen, and I'm the training programme director for the trainee pharmacies, and I'm currently working in West. And so I work in secondary and primary care, but today I want to talk to you about why primary care. So what is primary care pharmacy? Well, we're actually a team of multidisciplinary team, which consists of pharmacists, pharmacy technicians, admin team, medicines management, nurses, data analysts, stoma nurses and continence nurses, and a dietitian. And we all work together quite closely. The role of the primary care team has developed significantly over the last couple of years, and our emphasis is on delivering the best possible care for patients, and our aim is preventing people from becoming ill and encouraging healthier lifestyle as to keep them out of hospital. We play a significant part in managing medication. We have a strategic role to focus on maximising benefit and minimising risk associated with medicines, as well as making the best use of resources allocated to medication. And finally, we provide support for GPs, nurses, community pharmacists, and other healthcare professionals at the same time. So what do? We support primary care and community care with medication-related advice, queries, medication safety issues, and governance. We support GP practices to deliver the prudent prescribing local enhanced schemes, so cost-effective prescribing target, medication safety target, and quality improvement targets at the same time. We have funding in place for pharmacists to run independent prescribing clinics in some GP practice, so whether they're respiratory clinic or hypertension clinic, etc. But these days, we also have pharmacists in some health board managed practices playing a critical role in the team and providing a clinical services alongside the GPs and the ANPs part of that GP surgery as well. So what's exciting? Well, as mentioned, there's been a big shift in recent years and the focus within the NHS towards primary care. If we think now, I don't think we would have imagined 5 years ago we would be undertaking some of these tasks, to be honest with you. So what do? So why is it exciting? So when we think about how much we've actually changed and achieved over the last 5 years, so we undertake medicines reconciliation of documents, etc., without requiring clinical oversight or without SOPs in place. We undertake different levels of medication reviews, face-to-face these days, over the phone and screen reviews. We review care home medication counselling for patients, and acute medication queries from other healthcare professionals. And then we become to a little bit more exciting. So we offer lifestyle counselling for patients with high cholesterol. We assess their Q risk scores, lifestyle counselling for patients with identified with fatty liver disease and raised ACR, so which identifies kidney disease in some of these patients. we reauthorise batch prescriptions, we triage of acute medication requests, do we refer them back to the community pharmacies, is it appropriate for that acute prescription? We undertake hypertension annual review, asthma annual review, COPD. We also focus on DOAC, warfarin annual and interim anticoagulation reviews, and we also dose patients for warfarin at the same time as well. We newly start patients on diabetic medications and provide lifestyle counselling there as well. HRT annual review, oral contraceptive reviews, osteoporosis, lifestyle counselling and bisphosphonate. Levothyroxine, dose titration and their referral from GPs. And finally, we also have expertise to provide depression and anxiety annual reviews. So it's quite a significant list, and obviously we don't undertake all these tasks initially when we're starting a career, but when you think about how far we've come and what we can achieve at the same time, and we can obviously increase our expertise, and this is where we want to aim. This is what we want to be doing so that we're able to undertake all these tasks as part of the GP practice. So my role as a primary care pharmacist, a typical day, I see 10 patients in the morning, 12 patients in the afternoon, a few tasks, so medicines management queries, waiting to be actioned, document. So these tend to be non-urgent prescription requests, TTOs, monitoring, titrate medications, emails from clinics, patients, and then I move them onto my list as needed to be. And the type of patients I deal with are uncontrolled hypertension, polycontrolled diabetes, raised ACR, cholesterol, polycontrolled INR, and those overdue medication reviews at the same time as well. So just give you a couple of examples just to actually give you an insight of what I do on a daily, weekly basis. So these are just a couple of examples of patients that I've dealt with in the last week. So quite a few uncontrolled hypertensive patients, titrated, started new medication and arranged follow-up blood tests for them and review appointments with the advanced healthcare assistant. I then had a patient, a diabetic patient with a HbA1c of 117 millimole per litre. Wow. So as we're aware, that's quite a significant number. So we started them on metformin, counselled them, and obviously, slowly titrated her on the standard metformin. So we've been going back and forth now over the last couple of weeks, maybe we're going even to 2 months now. She wasn't able to tolerate the plain release metformin. So we've swapped her over to the modified release metformin, and when she is able to tolerate it, so hopefully she'll be continuing to take her medication. She's made some lifestyle counselling. We've referred her to the appropriate courses. So hopefully when we repeat her HbA1c, we will see a difference, hopefully. So yeah. Then I had so the nurse came to see me and she was concerned. She had a patient with an INR of 1.1. So I went to question the patient and see what was going on in this particular case. So the patient was taking the warfarin for AF. He didn't have any recent clots or didn't have a mechanical valve or anything. So I was fairly confident that he didn't need enoxaparin in this particular case. But we needed to know why his INR had become, so low, to be honest with you. So his wife was actually managing his medication. So we spoke to the wife, we asked some questions. No, there's no changes to our medication, our lifestyle, everything's as normal. But there was obviously something going on. So we just dug a little bit deeper and talking to her and asking about colours, etc. And actually, she'd been mixing up between her 5 milligrams and her 0.5 milligram. Oh. So in this particular case, we advised Mr. Jones to continue with his usual dosing regime and ask him to come back for his INR test next week, to be honest with you. So it just demonstrates how important our role as pharmacists, doesn't it? And another exciting one we had last week was we undertook a medication review on a 94-year-old gentleman. He wanted a face-to-face review actually because he was hard of hearing. So on questioning him, he was prescribed sulfaenol. However, he still complained of incontinence. Unfortunately, he couldn't find pads that suited him either and was feeling off balance when he was leaving the house. So on speaking to him, we decided actually to try to stop the sulfaenol and to speak to, so we spoke to him again next week, and there was actually no difference whatsoever in terms of his symptoms without the sulfaenol. So we've stopped he felt more confidence, the loss of balance, etc. And in this particular case as well, with incontinence, we referred him on to the continence nurse for advice, because he could also get the pads because he was currently buying them as well. So if he didn't need to, we referred him for advice in that particular case as well. So as you can see, there's a good variation there of tasks that we undertake, and you can see how exciting it is. No day is the same as another day. You don't know what you're going to be facing on that particular morning with, you know, the different reviews, etc., the queries that come through your door, and what's been referred to you by the GP for you to deal with on them or these particular days. So we're very lucky as here in North Wales, and I'm sure all across the whole of Wales, we've got pharmacists that are undertaking the list that I mentioned, what's exciting previously, that are undertaking all these tasks. So you would be very fortunate enough as a trainee pharmacist to get an insight into real life pharmacy and what we do on a daily basis. So these are the type of things we do, you know, seeing these diabetic patients, the hypertension patients, etc. And we also offer additional shadowing opportunity to shadow various healthcare professional clinics, the GP, the healthcare assistant, the dietitian, the physiotherapist, the occupational therapist. But also we've been fortunate enough to provide visits with the stoma and the continence nurses, attend pulmonary rehab with our pharmacists, attend an AF screening clinic, which our pharmacists run up here as well, and to help out with the flu and the COVID vaccination clinic. So they're just some additional activities that trainees can undertake in primary care alongside shadowing their designated supervisor and the practice pharmacist at the same time as well. Any questions?
Thank you so much, Beth. That was wonderful. So exciting. There's so much going on in healthcare and pharmacy in Wales, isn't there? It's just tons. Yeah, does anyone have any questions for anything that Beth covered there? Just take a second. No, everyone's been very quiet today. They've been very hesitant in coming back. Okay, if you do have any questions at any point, though, if you think of anything afterwards, by all means, you can send them at any point through chat, or you can email us on the heiw.prp@wales.nhs.uk. We'll put that up at the end so you can see it. Thank you very much, Beth. So we've had representatives from community pharmacy and primary care pharmacy, and finally, of course, not least, last but not least, we have Ellen Evans now, who's going to come and talk to us about secondary care pharmacy, so in hospital. Ellen is the Foundation Pharmacist Training Lead at the Royal Gwent Hospital in Aneurin Bevan, and she's going to be talking to you now. Ellen?
Hi there, can everyone see my screen and hear me?
Yeah, that's great, thank you.
Lovely. So my name's Ellen Evans. I'm an education and training pharmacist at Aneurin Bevan Health Board. I'm going to be talking to you today about the secondary care rotation of your multi-sector training year. So this is a general overview about hospital pharmacy, and the content may vary slightly depending on what hospital you go to work in, but obviously you can save those questions for the breakout room. So you may already have an idea of what makes up hospital pharmacy, but there are lots of areas that work together to deliver a pharmacy service. So that includes your standard pharmacy service to wards or clinics. You've got the supply and distribution services, procurement, which involves all the purchasing and formulary of medication. You've got manufacturing, which includes the aseptic department, medicines information, and also clinical trials. So I'd like to talk to you just about some of the advances that are happening within hospital pharmacy at the moment. Transforming Access to Medicine Service, or TRAMS as it's known, is a new 5-year plan that's been set out by the Welsh Government to completely change the way aseptic services are delivered within Wales. So currently each health board is responsible for making or purchasing their own anti-cancer drugs such as chemotherapy or radiotherapy, and also TPN. But this new £67 million plan will set to see 3 regional facilities built across North Wales, South East Wales and South Wales, with lots of different hubs, and they'll be able to prepare all of these medications and more. So that will mean lots of different job opportunities, as well as leading to advancements in technology. So this year we've rolled out an all Wales dispensing system called WellSky. It's been able to link dispensing and purchasing nationally, which has allowed us to improve our stock management across all hospitals in Wales. But it's also taking us a step closer to going completely paperless within hospital. And then I just want to talk a little bit about the consultant pharmacist posts. So these were introduced in Wales in 2013. Consultant pharmacists are the most senior clinical experts in their field within pharmacy, and they lead on the development of national guidelines, publish up-to-date research, as well as delivering high-quality patient care. Currently, we've got 14 consultant pharmacists across Wales. And then just touching a bit on clinical trials, because it's quite topical at the moment. This is a massive area within pharmacy, and as pharmacists, we play an integral role into the management of all clinical trials, or most trials that involve medication. So this can involve writing protocols, enrolling patients, randomization, and then the supply of trial medication. I work for an Iron Bevan Health Board, and we were selected to be one of the health boards involved with the Oxford AstraZeneca trial. So we recruited over 2,500 staff members into that trial. So looking at the different roles within hospital pharmacy, this is just a way that I've broken them down, but there's lots of different roles once you are qualified as a pharmacist. If you look at clinical roles, then you're able to specialise as a pharmacist. That could be in areas such as mental health, gastroenterology, cardiology, paediatrics, oncology, the list goes on. And we also have pharmacists working at the front door, which includes your A&E emergency department. There's also, these experts in the fields will be able to prescribe for patients. They might be independent prescribers. They might be running their own clinics and also working as part of a multidisciplinary team, so attending ward rounds. Clinical pharmacists might also have directorate responsibilities, so they might be responsible for managing a budget for their specialist area, and they'll also have responsibilities such as horizon scanning, where they're looking for new drugs that are coming onto the market to see how they can implement new guidelines to use them within their area. There's also medicines information, where they provide specialist information on areas such as interaction, stability, administration, and that can be to healthcare professionals across the health board, but also to patients. And then we've talked a little bit about the consultant pharmacist posts as well. If you look at technical roles for pharmacists, so there's the roles within production, so that's your aseptic pharmacist, so they'll be responsible for the department making up chemotherapy and also TPN. You've got pharmacists involved in the quality assurance and quality control of unlicensed medication, and again, aseptic made medication. And there's also pharmacists working within procurement and formulary as well. There's also roles within education and training. So I have a split post where half of my time is dedicated to training within the health board, and then the other half of my time is working on a medical admissions ward. So if you're involved in training, then you might be working on updating training plans, tutoring trainee pharmacists like yourselves, and mentoring qualified pharmacists who are working through their foundation framework, and then middle grade pharmacists that are working on towards their advanced framework as well. And then you've got pharmacists in the management area. So this is going on up through your career. So they might be in team leader positions, principal pharmacists, and you may aim to be a chief pharmacist at the end of it. So what to expect, and again, this is just a general overview, but the aim of your secondary care rotation is to develop your clinical pharmacy skills so that you're able to manage a group of patients and set you up for your future pharmacy career. You'll be working within different areas of the pharmacy, such as the dispensary, medicines information, and maybe production. And then on the ward, you'll be working closely with your supervisor to develop your inquiry answering skills, consultation skills, and also your medicines reconciliation. There should be opportunities for you to spend time with specialist pharmacists, attend MDTs and ward rounds, and then when you've developed all those skills, there might be opportunities for you to supervise undergraduate students and newer members of staff. Hope that's okay.
That's wonderful. Thank you very much, Ellen. That's great. So It's lovely to see the different people all involved in training in Wales being able to contribute on this, and I hope it highlights to all the trainees here that or potential trainees how we all try and work together to deliver the best program we can for you. So we have one more speaker before we open up the breakout rooms. We're lucky to have Dana with us, who was one of our trainees last year who went through our multi-sector training. She undertook it last year and is now a qualified pharmacist, and she's going to share with us her insights today of her experiences. Dana, are you ready?
Yeah, I'm ready. Thank you.
Do you want to share your screen?
Yeah, I don't mind. Can everyone see my screen?
Yeah, that's wonderful. Thank you.
Yeah, perfect. So I'm Dana. I was a career edge last year with HEIW Wales, and I've done my MPharm at Sunderland University. So I've come all the way to Wales to do a multi-sector career edge that involved 4 months in a community pharmacy, 4 months in secondary care, and 4 months in primary care. So the first few months of career edge were pretty much all about adaptation, just not being a university student anymore. And it was all about trying to train to become a pharmacist. So it was a bit different from university and a bit different from university placements as well. So because that was a multi-sector pre-reg, that involved doing learning outcomes for each of the sectors that I went to, in addition to the learning outcomes I had to do for all of the sectors. So because of that responsibility, that was a bit of extra work. But then here we had an organized program guide that allowed me to keep track of my progress with my tutor in each sector. So they had a week by week organized schedule that allowed me to just go on it every weekly meeting with my tutor and decide what needs to be done for the week that's coming up. So that was a very worthwhile experience, and I'm gonna talk about why was it worthwhile as well. So what was rewarding about my experience was the fact that I was able to shadow various pharmacists, various IPs, GPs, and other healthcare professionals. So that really helped me to understand the role of each healthcare professional in a healthcare setting in whatever sector that I was in. It also allowed me to transition that theoretical knowledge that I've gained at uni to the practical knowledge of being a pharmacist. So that was through the medication reviews that I was able to do in primary care and in community pharmacy, the various counselings I've done in the 3 sectors, and the various specialist consultations I've done with relevant IP pharmacists. So that was either including diabetic pharmacists, respiratory, mental health. I've sat with them through their consultations with patients, and that really helped me to understand more about that specialty rather than reading about it from a book or from lecture slides. So apart from all of that, I was able to also learn the practicalities of each sector. So at uni in 4th year, we've done a business module about community pharmacy. So being able to actually use that knowledge that I've gained at uni and apply it into a real life community pharmacy business management aspect, that was very educational. And it also allowed me to know more about the financial implications that a community pharmacist manager goes through day by day. Apart from that as well, I've learned more about the primary care targets. So each GP surgery got their own targets. And one of the targets that I was able to participate in was the better antimicrobial prescribing. That was through the audit that I've done. And I was able to share my results with the GPs in the surgeries. The secondary care, I've learned more about the formulary and the non-formulary prescribing. So that was really beneficial in terms of the prescribing in secondary care. So my benefit to my current practice was that I was able to gain all of that clinical and practical knowledge and all those transferable skills, and I was able to use them in my current sector, as well as use them to pass the exam, the pre-reg exam. So I'm a person who learns more from practical experience rather than from reading lecture slides or notes. So that really helped me to consolidate my information to pass the exam. From the community pharmacy point of view, I was part of various consultations, including EHC minor ailment scheme, which is a Welsh scheme that's very worth reading about, and discharge letters consultations, as well as the usual OTC and methadone patients management. In secondary care, I've had the experience to go through various wards, including medical and surgical wards, as well as be part of DUAC and warfarin initiation counselling, and learning more about the role of the pharmacist in the aseptics unit and in the medicines information as well. The primary care, as Bethan said, I've done all those various medication management tasks, and I was part of them with my supervisor. I've learned lots from various healthcare professionals, various IPs, as I've mentioned, and through the various, not just IP pharmacists, but also physiotherapists and other nurse prescribers as well. So one of my knowledge application example is that through me shadowing the respiratory pharmacist in primary care, talking to a patient about their inhalers, I was able to use that knowledge in community pharmacy and secondary care, and the patients were very appreciative of that. So the opportunities to be gained, the multi-sector experience, it really helps you to decide which sector do you want to go to post your foundation year. Myself, I liked variety, and I chose to go on to a dual sector position in community pharmacy and secondary care. But also it's going to equip you with the various skills, which is going to be very appealing to diverse employers, and it's going to give you the confidence to go to whatever sector, whatever route that you want to go to in the future. And also you've got that advantage to explore the beautiful nature of Wales. So during your breaks, you can always go up mountains or go walk around greenery fields, which is very relaxing as well. So that's an advantage. Best of luck to everyone, and hope you choose wisely post-college.
Thank you, Dana. That was wonderful. It's so nice to hear such your experience of going through the training last year, and I hope all the students on here today will really benefit from your insights. I've been seeing some questions coming through on the chat. Does anyone have any specific questions to Dana now before we open up the breakout rooms so you can go and visit the specific localities around Wales? Just double checking. No, doesn't look like anything's coming through at the moment for you specifically, Dana. Thank you very much for that. That was wonderful. Okay, everyone. So what we're going to do now is open up the breakout rooms. So what's going to happen is within each breakout room, we'll host 2 of the health boards. So in South East Wales breakout room, there will be an Erin Bevan and Cwmtaf University Health Boards. In the Cardiff area will be Cardiff and Vale Health Board and Velindre Cancer Care Centre. In the West Wales locality will be Swansea Bay University Health Board and Hywel Dda University Health Board. And in the Mid-North Wales locality will be Powys Teaching Health Board and Betsy Cadwaladr University Health Board. So once we open the breakout rooms, the health boards will each present within the breakout rooms that they're in, just to give an overview of how they will deliver the programme to you and why they think you should come and apply to that programme in their locality. And you will, of course, have a chance to ask them specific questions about the area that they're in and why you should go there as well. So okay, hi everyone, just waiting for the last couple of people to return from the breakout rooms. Okay, it looks like almost everyone's out. Okay, wonderful. Well, thank you very much to you all for coming today. I hope you found it interesting and informative, and that you have a better idea of what Wales can offer you in terms of your training in foundation year. If you do have any questions, please, by all means, email us. We will be sending you an evaluation survey out at the end of this presentation of this event as soon as we finish, and that you can reply, ask any questions to that email address as well, which is our central inbox, which is heiw.prp@wales.nhs.uk. I really hope it's shown this event how exciting it is to train and practice as a pharmacist in Wales. And I really hope you'll consider applying to our programme or one of the programmes through Oriel this year. Like I said, any questions, please feel free to send them through to this email. But we do have the last 10 minutes for any last questions if you do have any now. So over to you guys. If you do have any questions, please feel free to pop them in the chat or raise a hand, and we will do our best to answer them from everyone here that's attending today. Otherwise, all I'd like to say is thank you to all the facilitators that have attended today. It's been wonderful to have you on board as well, and so nice to see everyone participating to deliver the programme across Wales. Thank you very much, everyone. So does anyone have any questions at all? No.
Nothing popped in the chart there, Martin.
No, nothing popping up. Okay, well, thank you very much, everyone. If you wish to go, feel free to leave now then. We'll send the survey afterwards. I hope you found it useful. And hopefully, I'll see you all next year when you apply to our programme and we see your induction. Thank you, everyone, who has come today. It's been an absolute pleasure to see you all.
Thank you. Thanks all.
Thank you, everyone.
Thank you.
Thanks all. Have a great day.
Thanks everybody.
Thanks, everyone.